Assalamualaikum warahmatullahi ta'ala wabarakatuh. Good day once again. So in this video, we'll discuss the last chapter or last topic that will be included in your final exam coverage. Okay? So, previously na-discuss na natin yung therapeutic diets. Yes, na isa-isa natin yung ano yung mga pwedeng mga diets na pwedeng ibigay for a certain patient. Pero ngayon, I wanted to be more specific. So ngayon, isa-isahin natin yung mga iba't ibang nutrition therapy para sa mga patient with obesity, with cardiovascular diseases, with diseases in the kidneys, okay? May mga sakit sa gastrointestinal tract, may sakit sa liver, gallbladder, and pancreas, or yung patient na may sakit na cancer, or yung patient na may sakit sa periodontal, or yung sakit sa ngipin at saka bunganga. So, isa-isahin natin yung mga iba't ibang therapy or mga diets na pwede sa kanila. So first is the nutrition therapy for obesity and weight control. Obesity is a condition in which the natural energy reserve is increased. It is a hazard to health. Pag sabihin natin hazard, yan yung hindi maganda na epekto sa health natin. 'Di ba napapansin niyo sa lahat ng mga disorders or mga sakit na pwedeng makuha ng isang tao, pinaka-main na mga risk factors or mga reasons bakit nagkakaroon ng sakit yung tao, it's because of obesity. Yung sobrang paglaki ng isang tao at paglaki din ng cholesterol, mga bad cholesterol sa kanyang katawan. So, it is not surprising that obese people are prone to heart diseases, gallbladder diseases, diabetes, or other chronic diseases. An obese pregnant woman is more likely to have complications than a woman of normal weight. That's why every pregnancy, tinitake natin, di ba, discuss natin yung nutrition for pregnant woman. Kailangan na monitor natin. Hindi dahil, di ba yung laging sinasabi ng mga buntis na, kasi kumakain ako para sa baby. Hindi nila naiisip na sobrahan na, lumalaki yung baby, at the same time, lumalaki din sila. So, hindi na maganda para sa bata yon. So, the degree of obesity is often judged by comparing what one weighs with the height-weight table. If one weighs 10 to 19% more than the average for his or her height and body frame, he or she is overweight. Di ba nare-remember nyo yung pagkuha natin ng Nare-remember niyo yung pagkuha natin ng BMI or basal metabolic index. So chine-check natin yung kanyang height, 'di ba? Yung times the weight niya. Weight times the height, 'di ba? Squared. So yan. Mino-monitor natin kung tama ba or angkop ba yung kanyang weight sa kanyang height. So doon natin na sasabi na okay, you're an obese patient. You're in overweight. You're in normal weight or under weight. So losing weight simply means balancing food calorie intake with the body's needs for calories. Especially nowadays, masyadong focus tayo with our image, body image, na somewhat we do have different diets para maganda ka tingnan, okay, para sexy ka tingnan. It's because of the media or the social media effect, okay? So, 1 pound of fat is equal to 3,500 calories. And if one has 500 calories less every day, he or she will lose 1 pound a week. So, pag i-less mo yung calorie intake mo, automatic na makaka-less ka din ng inyong weight. So, the state of being overweight and obese is a condition in which the body stores fat, okay, and are enlarged. Yung pag-store niya ng fat is sobrang malaki. So, underweight and our undernutrition results when intake does not meet the energy requirements. Usually, an underweight person weighs 10 to 20% below the desirable weight. So, ano ba yung mga reasons bakit nagkakaroon tayo ng excess na calorie intake? First, the family pattern of rich, high-calorie foods. The mother of any household member being a good cook. 'Di ba? Pag maganda or masarap magluto yung nanay, napapasarap yung kain mo, napapa-increase yung intake mo ng kanin. Okay? So, nag-increase doon yung calorie intake mo kasi 'di ba, main source ng ating calories is yung rice. Next, good appetite. Pag sobrang ang hilig mong kumain, lalo na pag stress eating ka na tao, yung kumbaga pag stressed ka, mas tumatakaw ka. Nako, yan yung mga isang mga reasons bakit nagkakaroon ng excessive intake of calories. Meron tayong ignorance of calorie value. I think lahat naman tayo, even me, kahit naituturo sa atin yan, hindi tayo calorie conscious na, calorie conscious na every now and then yung kakainin natin, i-check natin, di ba, yung nasa nutritional value, okay, calorie nito, kinakalculate, no, hindi tayo yung mga ganyang tao na kinakalculate natin yung calorie natin. Next is skips breakfast, which is a frequent nibbler, takes coffee break with high calorie snacks. Yan, mahilig tayong mag-skip ng breakfast kasi sasabihin natin, sige lang, pag lunchtime, palalakihin ko yung kakainin ko. So, doon pa lang sa isang meal, sobrang increase na yung calorie intake mo. And what if ikaw yung tipong tao na not active? After kumain, umupo, natulog, nako, hindi na maganda sa ating katawan yon. Next is for pattern of living. If you have sedentary lifestyles, mahilig kang maglakad, magsakay, di ba? Every now and then, motor, pedicab, yan, dahil gusto mong, napapagod ka, konting kembot mo lang dyan, konting lakad mo lang dyan, napapagod ka, little exercise during leisure, often sleeps more as person becomes older. We have also emotional outlet, yun yung sinasabi kong stress eating. Okay? It's to overcome worries and problems. Next is many social events, serving rich foods, frequent eating and restaurants, yan, pag-attend ng mga birthday, pag-attend ng mga kanduri, pag-attend ng mga weddings, so syempre may lamon dyan eh. So, kain ng kain ng kain kasi wala din, sabi nga nila, hindi daw maganda yung nagre-refuse ng pagkain, kaya yan, tumataba. And then, we have lower metabolism with increasing age. As we age kasi talaga, yung functions ng ating body nagde-decrease. So, pag lumalakas yung pagkain mo na matanda ka na, tapos, 'di ba, nagde-decrease yung metabolism mo, tumataba ka ng madali. And also influenced by advertising of many high calorie foods. 'Di ba, yung nakakatakam ng mga cakes, brownies, ice creams, any sweets or mga food na high calories such as samgyupsal, ramen. Ako, yan, mga uso yan siya na nakakatakam talaga. So what are the things that we need to do, okay, in order to prevent obesity or the prevention for obesity? First, there should be a change in the eating patterns of families. So kailangan hindi lang isa lang yung nagche-change. As much as possible, lahat na. Hindi sinasabi na lahat magda-diet. Ang sinasabi dito is i-lessen lang yung mga foods na high in fats. Kasi whether we like it or not, hindi siya maganda na effect sa ating katawan pag sumobra. Kaya nga sabi nila, pag kulang hindi maganda, pag sobra hindi din maganda. Next, children should be encouraged to get more exercise and should be assigned to perform some chores requiring daily physical activity. Hindi yung papabayaan mo na lang yung bata dyan, sige, laro ka na, mag-PSP ka na, sige, maglaro ka na ng Mobile Legends, sige, kung ano-anong ginagawa mo dyan na pinapabayaan mo silang maglaro at wala kumbaga, hindi mo sila pinapatulong sa bahay, yan, nagiging tamad sila. So, preschool children should not be bribed or rewarded with food. They should have a variety of activities so that they can take their minds off the excessive pleasure of eating. Hindi yung sasabihin mo, sige, pag malaki yung score mo dito, pakakainin kita sa KFC, pakakainin kita sa Jollibee. Hindi dapat ganun. Hindi lang naman form of reward is yung food. Meron ding monetary, meron din tayong papupuntahin natin sa iba't ibang place, hindi lang food. Next is for planning for weight loss. If you are the people, ito yung mga ilan sa pwede nating i-advise sa mga patient natin na nagpaplanong mag-weight loss or magtanggal or magbawas ng weight. First, planning for weight loss should be directed by a physician. So, as much as possible, you need to visit if your physician or a nutritionist para alam mo paano. Kasi hindi rin healthy yung bigla-bigla kang maglulose ng weight na isa-starve mo yung sarili mo, hunger strike, hindi ka kakain. So, hindi yan siya maganda. Next, it should set a reasonable goal. So, dapat yung goal mo is reasonable. Hindi dahil kasi gusto ng boyfriend ko na ganito, very slim ako. No. You remember that the weight loss, it should be for you. Okay? Ang reason mo is para sa sarili mo. If you want to feel confident about yourself, then do it. If you want to be healthy and prevent any kind of diseases, then do it. Do not do it for another people or for someone na hindi naman maganda. Okay? Next, it must keep a weekly weight chart. Okay? Pag na-weight loss ka, kailangan na-check mo yung weight mo every now and then. And also, it must include an exercise regimen. May mga tao na nag-advise na, okay, diet lang yan, kahit hindi ka na mag-exercise. No, hindi pa rin healthy yon. Dapat meron tayong exercise. So, ano yung pwedeng maibigay sa mga patient na ano to, obese? Okay, ito yung mga low-calorie diets. Usually, women usually lose weight satisfactorily on diets restricted to 1,000 to 1,500 calories, whereas men lose satisfactorily on diets furnishing 1,2 to 1,8 calories. So, bed patients such as those with heart diseases are often placed on diets restricted to 800 to 1,000 calories and sometimes less. So, yan yung mga pwede nating ibigay sa patient, mga obese patient, okay, they have to take low-calorie diet. So, meals with low-calorie diet should be attractive and palatable. Para, di ba, kasi, ano to, nakaka-deprive man kasi yung tingnan yung plate mo na walang kalaman-laman. Nakaka-deprive yan ng appetite. So, make sure na presentable siya, nakakaakit pa rin siya kahit low yung calorie intake mo. So, low-calorie diet should not include alcoholic beverages. Yung mga beer, anything, wine, hindi pwede yan. Sweetened carbonated beverages such as yung mga Coca-Cola products, Pepsi, mga cakes, candies, cookies, cream, fried foods, sweetened fruits, pastries, pies, potato chips, pretzels, puddings, and others. So, avoid lang, parang pag low-calorie diet, pwede ding less calorie, less sugar. So, kailangan less din yung sugar niya. So, sample menu, pag gusto mong 1,200 calories, so, sa breakfast, half banana, soft-cooked egg, 1 sliced toast, 1 teaspoon of butter, and coffee without cream and sugar. For lunch, we have salad, we have 1 cup rice, 1 skim milk, and sliced papaya. Yung skim milk is a type of milk na very less yung kanyang fat. Okay, percentage of fat. For dinner, we have roast beef, boiled vegetables, rice, tea with lemon. So, nakikita nyo, di ba? This is a type of diet na nakikita mo na hindi naman deprived ka sa meat, hindi ka naman deprived sa rice. Okay? Hindi healthy talaga yung, okay, no rice diet ako. Kailangan pa rin ng ating katawan na rice. For bedtime, 1 apple and cheese. Next, let's discuss naman is the nutrition therapy for diabetes mellitus. Again, diabetes mellitus is a disorder na increase ang inyong blood sugar. Again, increase ang blood sugar. It's either type 1 or type 2. Pag sabihin nating type 1, yan yung mga dependent sa insulin. Insulin is a hormone that is produced by our body in order, okay, or it is a very important for the absorption of glucose. Without insulin, hindi ma-absorb ang glucose. And dahil ikaw, example, ang patient na may type 1 diabetes, hindi sila produce ng enough insulin, that's why tumataas yung kanilang blood sugar. Kasi nakasteady yung ating glucose sa ating blood kasi hindi siya pumapasok sa cell. While as pag type 2 diabetes, okay, they are mga non-insulin dependent. Yung body natin, yung body nila nakaka-produce pa rin ng insulin. However, pwedeng yung cell is intolerant of insulin. Meaning, hindi nila ma-absorb yung insulin or kahit meron siyang insulin, sobrang liit naman compare sa dami ng glucose na ini-intake. So, ganyan yung ating type 2 diabetes. Again, type diabetes mellitus is a metabolic disease that affects the endocrine system of the body and the use of carbohydrates and fats. Specifically, there is not enough insulin available for the body's needs. In some patients, the islets of Langerhans, which is nasa pancreas yan siya, are unable to produce enough insulin. In other patients, the pancreas requires some stimulation to manufacture enough insulin, and in some, the insulin that is produced cannot be used for some reason by the tissue. So, yan yung mga ilan sa reasons bakit nagkakaroon ng diabetes mellitus sa isang tao. So, ito yung two types. We have the juvenile diabetes, which occurs at any age, and adult type diabetes, which occurs primarily among obese people who become diabetic in middle age. So what is the characteristics of diet of a patient with diabetes mellitus? So the diet is essentially normal, except that the amount of food and their distribution in meals are controlled from day to day. Some diet control will be necessary for the rest of the lives of the patient. So, typically, dahil increase yung blood sugar ng patient natin, so, dinidecrease natin yung sugar sa intake nila na diet. First is we need to check for the energy. Okay. Overweight diabetics are initially placed on low-calorie diets because weight loss results in better tolerance to carbohydrate. Individuals of normal weight are given sufficient calories to maintain their weight. So, yung mga patient na nasa bed lang siya, confined in bed, 11 to 12 calories per pound. For sedentary, 13 to 14 calories per pound. And moderately active, 15 to 16 calories per pound. So, example, 100 pounds yan siya. So, i-times natin siya sa 15 to 14 if moderately active. Pag naman meron siya sedentary lifestyle at pounds siya is 90, i-times natin siya sa 14 to 13 calories. And then, pag confined siya in bed at kanyang pounds is 80, i-times natin sa 11, yun ang ating energy or needed na calories ng ating patient. For protein, about 1.5 grams per kilogram body weight is usually allowed. The higher level is more typical for patients who show a preference for protein-rich foods. For carbohydrate and fats, after subtracting the calories provided by protein, the remainder of the calories for the day is usually divided about equally between carbohydrates and fats. The number of grams of fat is ordinarily about the same as the number of the grams of protein. The amount of carbohydrate is roughly twice the number of grams of protein. So yan yung pwede nating mga sample ng caloric levels of meals for diabetics. Ayan. Pag meal plan 1, kung ang carbohydrates is 125, bibigay natin na protein 60, and then sa fats 50. So, energy total of 1,200. So, ganyan yung mga meal planning. Careful tayo sa pag-prepare, okay, or pagpa-plan ng mga patient with diabetes mellitus. So, food preparation and service. All food items in the diet are measured according to the amounts in the food exchange list. Level measures with standard measuring cups and spoons are used. Food are prepared using only those allowed on the meal patterns. No extra flour, breadcrumbs, butter, or other foods may be used. Meats may be broiled, baked, roasted, and stewed. If they are fried, some of the fat allowance may be used. Frozen or canned fruits packed with sugar must be avoided. Again, less dapat yung sugar intake ng mga patient with diabetes mellitus. Concentrated sweets and desserts are avoided. Sugar, candies, jellies, marmalades, syrup, honey, molasses, soft drinks, cakes, cookies, pies, pastries, sweet rolls, and etc. So, dito sa food exchange list, an exchange list is a grouping of foods in which the carbohydrates, protein, and fat values are about equal for the items listed. So, the following are the steps in planning the measured diet. First, gagawin mo, include the basic foods to ensure adequate levels of minerals and vitamins. At least 2 cups milk or 3 to more for children, 5 ounces of meat, 2 servings of vegetables, 2 servings of fruit, breads, and cereals. So, yan yung i-divide mo. Yan yung mga basic foods na kailangan, and then i-divide mo siya per meal. Then list the carbohydrates, protein, and fat values for milk, vegetables, and fruit. Subtract the carbohydrate values of these foods from the carbohydrate level prescribed. Subtract the total value or protein values of milk and meat from the total fat described, and subtract the total fat values for milk and meat from the total fat described, and then divide the difference by 5 to determine the number of fat exchanges. Yan yung mga example ng exchange list. So, from the word food exchange list, ano yung example? Ano yung mga food na pwede nating palitan? Dahil hindi natin ma-afford to, ano yung pwede nating palitan dito na the same lang sila ng protein content, the same lang sila ng fat content, the same lang sila ng minerals or vitamins content. So, ganun yung paggawa natin ng food exchange list. Okay? So, meal pattern for a for a diabetic patient. Sa milk, 1 exchange. Fruit, exchange to 1. Bread, 2 exchanges. Meat, 1 exchange. Fat, 2 exchanges. Yan. Sorry. And then here, the sample menu, we have the 1 cup milk, 1 for medium papaya, 1 cup rice, 1 egg, okay, with 1 teaspoon butter. We have for lunch, 1 cup milk, 1 cup rice, pork sinigang, banana. Syempre, hindi tayo kumakain ng pork, so pwedeng beef sinigang yan siya, or chicken sinigang, or fish sinigang. Then, banana for dinner, fried bangus, pinakbet, 1 cup rice, and pineapple. So, yun ang as you can see, hindi very specific. I mean, hindi sinabi na, okay, low calorie diet, hindi. Ang dito sa nutrition therapy for diabetic mellitus is that it is very measured. Every meal is accounted for. And normal foods yung binibigay natin. However, kailangan na monitor natin yung kanyang fat intake, the calorie intake, ang kanyang protein intake, and also the sugar. Next, let's discuss naman yung mga nutrition therapy for diseases of the gastrointestinal tract. Yung mga patient na may sakit sa GI tract. First, we have peptic ulcer. So, peptic ulcer is an ulceration in the protective inside layer of the lower esophagus, stomach, and duodenum. So, the dietary treatment for peptic ulcer requires the preparation of a bland diet. Pag sabihin nating bland diet, yan yung mga walang lasa, walang seasonings na pagkain, walang salt. Kasi, yung kumaga hindi nakaka-irritate sa GI lining or GI tract ng patient. So, particular emphasis is placed on nutritive adequacy, ability of the diet to dilute, neutralize, or reduce the secretion of acid by the stomach. So, isa sa mga bland diet na example is yung hindi dapat spicy yung food, hindi dapat sobrang init, hindi dapat malasa kasi kailangan wala ngang lasa, and the ability of the diet to avoid mechanical, chemical, or thermal irritation. The bland diet is a nutritionally adequate diet that includes food that has bland flavor and soft consistency and mechanically and chemically non-stimulating. Nutritive adequacy is expected of any diet used for a long term of time. Unfortunately, many restricted diets used for patients with peptic ulcer do not provide sufficient protein, minerals, and vitamins when giving for a long period. Other diets may be adequate in terms of calculated nutritive content, but if the ground meats and pureed foods are so poorly eaten, the patient will still be malnourished. Okay, so ang trend ngayon, it is towards more liberal diets that the patient can enjoy and thus improve nutrition. Sufficient protein and ascorbic acid are especially important in healing of ulcer. So the most important therapeutic quality of a diet for peptic ulcer is that it assists in diluting, neutralizing the stomach acid. So as much as possible, ang gusto nating mangyari is yung mga food na ini-intake ng mga patient with peptic ulcer is hindi natin ma-stimulate further yung ating stomach na mag-produce pa ng acid. Kasi once magkaroon ng produce ng excessive acid, nagiging stimulated yung tiyan at nagkakaroon ng irritation. fermentation. So fat has some ability to inhibit the secretion of acid. It also delays the emptying time of the stomach. The fats of cream, milk, butter, and eggs are easily digested and may be beneficial in this respect. Next naman na disease is a diverticular disease or it's either diverticulosis or diverticulitis. Diverticulosis is a type of, kumbaga, meron siyang diverticula or para siyang excess tissue na balloon, parang gano'n, yung nagkaroon ng pouching yung ating intestine. So, example, ito yung ating intestine, nagkaroon ng pouch dyan. Okay? Parang yung kangaroo, di ba, may pouch yan siya. That is diverticulosis. Pag ito siya ay magkaroon ng inflammation, okay, nagmaga yan siya, nag-inflame yan siya, yan yung tinatawag nating diverticulitis. These are often consequences of long-term low-fiber eating practice or frequent constipation. Diverticulosis indicates the presence of diverticula or a pouch in the colon, which can lead to diverticulitis or the inflammation of the or the swelling of small pouches in the colon wall and lining. So inflammation develops the minute bacteria and other irritants are shared, causing spasms and pain in the lower left side of the abdomen. So a well-balanced diet with variety of foods and adequate protein is recommended. Acute episodes may require liquids and low residue foods excluding roughage. So dapat yung mga food na binibigay natin with diverticulitis is mga smooth. Hindi pwede or soft diet. Hindi sila pwedeng bigyan ng mga food na rough ang kanyang texture kasi magkakaroon siya ng irritation sa lining ng colon at pwede mag-cause ng swelling ng ating colon. So, as swelling abates, high fiber diet is recommended to lessen straining. Para pag nagtatae ka, lagi yung sabi nilang, ano tawag doon, yung parang in Bisaya pa, hindi tubol yung tae mo, hindi yung sobrang tigas, pero soft na siya. So next disorder is the malabsorption syndrome or a celiac sprue. It is a condition in which mucosa of the small intestine is damaged by gluten. Gluten is a carbohydrates. Okay, it's a type of carbohydrates na yung human lang yung nakakatake dyan. And pag may gluten intolerance ka, nagkakaroon ka ng malabsorption syndrome. So which results in the malabsorptions of nutrients. So apparently, non-tropical sprue naman is a diarrheal condition in which excessive fat is excreted to stool or excreted in the stool or yung tinatawag nating steatoria. Pag sabihin natin yung term na medical term na steatoria, it is the presence of excessive fat in the stool. Nitrogen, minerals, and vitamins are also excreted in desirable amounts so that the individual becomes severely malnourished. Pag ganyan na meron kang non-tropical sprue, nagkakaroon ka ng malnutrition. Apparently, many of these patients have an intolerance for gluten. They respond well when all foods containing these cereal grains are regularly omitted from the diet. So, kailangan ang ibigay natin sa kanila na type of diet is the gluten-free diet. Yung mga pagkain na sinaserve natin is dapat walang gluten. A high-protein diet is usually necessary. Mineral and vitamin supplements are often prescribed. Cereals and breads containing wheat, rye, or oats must be omitted, meaning tatanggalin. Thickened soup, cooked salad dressing, cold cuts, breaded meats, meatloaf, and mixes of all kinds must be avoided. Labels must be read carefully and make sure na walang gluten. Next, corn and rice cereals can be substituted. Breads, especially prepared with rice, corn, potato starch, or wheat, can be used to thicken soups, gravies, and puddings. A low-fiber diet may be better tolerated during the initial stages. So, na pag tae ka ng tae, so low-fat diet, a low-fiber diet, para at least hindi activated yung elimination process mo. So, typical menu for a gluten-free diet, we have two poached eggs, rice, meat with cream and sugar, banana. We have for lunch chicken nilaga with chili leaves and papaya, rice, pineapple. For dinner we have fresh paksiw, bulang lang. I really don't know what is bulang lang, but you can research on that. And rice, papaya. For bedtime we have milk. And if meron ka namang disorder na ulcerative colitis is an inflammatory bowel disease of the large intestine, meaning may problem sa ating large intestine. So, limited to the rectum and the colon, which causes profuse and bloody diarrhea. It is characterized by severe diarrhea, rectal bleeding, cramping, abdominal pain, anorexia, and weight loss. So, treatment is rest, nutritional therapies, and sulfonamide. So, diet therapy for ulcerative colitis or patients with ulcerative colitis, first, meron silang high protein diet. Extensive colon lesions require healing. That's why it's very good na increase yung protein intake ng patient. Kasi remember, the protein is a element na nakakatulong for wound healing. Next is high calories. So, about 2,500 to 3,000 calories a day are needed to spare proteins needed for healing and restoring nutrient deficiency. Next, increase vitamins and minerals. Supplements of vitamins and minerals as well as food sources are tolerated. Next, we have low residue diet. Fairly low in residue in acute stages is tolerated, and gradual increases avoiding only heavy roughage to prevent irritation. Next disorder is the lactose intolerance. So yan yung mga patient with lactose intolerance, yan yung hindi tolerate ng milk sugar. Again, so syempre automatic yan yung milk hindi nila naiinom. It is caused by deficiency of lactase, the enzyme which hydrolyzes lactose, the sugar, and milk. The undigested lactose remains in the small intestine and may serve as a substrate for bacterial fermentation. This disorder may either be congenital or may arise from other disease conditions such as celiac sprue, where the intestinal mucosa is affected or can occur after gastric surgery. Treatment, we have nutritional management. Okay? So, such as ang binibigay nating therapy is lactose-restricted diet. So, milk products, lactose, whey, and casein are avoided. We have also cottage cheese, aged cheddar cheese, and fermented milk products like yogurt can be given depending on the tolerance of the individual. Another disorder is diarrhea. This refers to the frequent loss of liquid bowel movement that prevents complete digestion and absorption, yung tae ng tae. So, there are two types. We have acute and chronic. Pag sabihin natin acute is the diarrhea only lasts for about 2 weeks caused by a viral, bacterial, or protozoan infection, medication side effects, or altered dietary intake. For chronic naman, a diarrhea which takes place for more than 2 weeks resulting from disorder like malabsorption, PEM, or yan yung ating protein, energy, malnutrition, or medical treatment. So, nutritional management for our diarrhea, we have nil per os or nothing or NPO, yan siya sabi natin NPO or nothing per orem or nothing by mouth for about 12 hours with IV fluids and electrolytes. Oral fluids as condition improves, liberal fluids to prevent dehydration, broths and electrolyte solutions to replace sodium and potassium losses, pectin to help control diarrhea, oral rehydration to be administered. So, yan yung paggawa ng ating ORS or oral supplementation, yung example ng paggawa ng oresol. We have 3/4 teaspoon of salt, 1 teaspoon of baking soda, 1 cup orange juice, 4 tablespoon of sugar, and 1 liter water. Pag mix mo yan siya, that is your oral oresol. Okay? Next condition is constipation. It is a condition in which a person experiences hard feces that are difficult to digest. Its symptoms are lack of appetite, lethargy, bad breath, distended stomach. Pag sabihin distended stomach, yung matigas yung kanyang stomach, and caked tongue. So type of constipation, we have three. We have atonic constipation, spastic constipation, and obstructive constipation. Pag sabihin natin atonic constipation, it is a condition experienced by older people, obese individuals before surgery and during pregnancy. Feces are huge and stiff. The causes are inadequate diet, irregular meals, lack of liquids and fiber in the diet, and irregular defecation. Pag sabihin naman natin spastic constipation, it is a type of constipation caused by overstimulation of the intestinal nerve endings resulting in asymmetrical contractions of the bowel. So the causes are extreme use of cathartics, laxative, tobacco, tea, coffee, and alcohol, stress, poor hygiene, lack of fluids, and irregular defecation. And lastly is the obstructive constipation. It is a condition in which the passage of feces is impeded or nagkakaroon ng obstruction or compression by surrounding tissues happens causing the drying and enlargement of the fecal mass. So ano yung diet therapy? Para sa mga patient na nagkaka-experience ng constipation, we have increased diet ng fiber, high fiber diet, at least 20 to 35 grams per day, liberal fluid intake. Prunes and prune juice contain laxative and may be helpful. And in acute attacks of spastic constipation, a low fiber diet can be given. For intestinal gas, yung sa tawag nating kabag, okay? Yan yung punong-puno ng tigira na samranaw pa na mapapanuan duaten yan. Okay? Or punong-puno ng hangin ng kanyang tiyan. So it may be referred to as increased occurrence of passage of gas or cramping pain associated with the buildup of gas in the GIT, gas swallowed or gas exchange in the GIT and blood or produced during digestion. So ano yung mga treatment or diet therapy? First is exclude food that produces gases such as yung kamote. Yan. Kasi kamote is very known na food na nagpo-produce talaga tayo ng gas. Utot tayo ng utot. Itlog, yan. Nagpo-produce yan siya ng gas. Next is small frequent meals and chewing food thoroughly are advised. For hemorrhoids naman, or yan yung tinatawag natin almoranas. These are enlarged veins which occur in the lower part of the rectum and anal opening. External hemorrhoids crop up when the rectum meets the skin, while internal hemorrhoids form completely within the rectum. The causes are constipation, prolonged use of cathartics, childbearing, and enemas. Yung mga taong nagkakaroon ng almoranas, yan yung chronic na yung kanilang constipation or gilalagay dito buntis kasi nga sa sobrang paglaki nung tiyan nung mother, nagkakaroon na-obstruct niya yung daanan ng tae, kaya constipated yung patient. So, ano yung nutrition management natin? Next, first is high fiber diet, at least 25 to 35 grams a day. Liberal fluids, 8 to 10 glasses of water per day. Highly seasoned foods and relishes are to be avoided. Low fiber diet is recommended during flare-ups. For gastroesophageal reflux disease or hiatal hernia and esophagitis or heartburn, this takes place 1 to 4 hours after a meal when a decrease in sphincter pressure happens. This is often caused by increased levels of progesterone brought about by pregnancy, oral contraceptives, smoking, and certain foods like chocolates, soft drinks, citrus fruits, juices, and caffeinated drinks. So, the treatment is to reduce intra-abdominal pressure and gastric acid production. Diet therapy includes avoid foods high in fat, avoid large meals, and limit foods that relax the lower esophageal sphincter. Then, increase the intake of foods that do not affect the lower esophageal sphincter pressure and maintain ideal body weight. Ano yung mga foods na nagre-relax ng esophageal sphincter natin? Alcohol, mints, chocolate, and high-fat foods. What are the foods naman that do not affect the lower esophageal sphincter pressure? Yung mga protein foods with low fat content or carbohydrate foods with low fat content. What are the foods that can irritate or damage esophageal mucosa? We have soft drinks, citrus fruits and juices, coffee, herbs, spices, tomato products, and very hot or cold foods. Next disorder is the short bowel syndrome. Short bowel syndrome is what we call the malabsorption disorder that is caused by resection of portion of the small intestine due to an illness or injury. So, nutritional management is very important for this treatment. Okay, and diet therapy includes parenteral nutrition. This is to be indicated if the enteral nutrition exacerbates symptoms. 'Di ba? Dahil nagkakaroon ng malabsorption disorder, meaning may problem na sa GIT function niya. So, pag hindi na kaya yung enteral feeding, parenteral feeding tayo. We have dietary fat restriction and frequent monitoring of fluids and electrolyte balance. Next for next let's discuss naman, okay? So yun yung mga nutrition therapy for gastrointestinal diseases. Ngayon naman is nutrition therapy for diseases of the liver, gallbladder, and pancreas. For the liver, let's start for the disease na hepatitis. Hepatitis is the inflammation of the liver. The following are the 5 types of hepatitis. We have hepatitis A, which is caused by virus transmitted by the fecal-oral route. Pag sabihin natin fecal-oral route, galing sa tae and then naka-ingest ka ng kung example, hindi ka nakapupo ng maayos, yan siya, may virus doon, nakain mo, yan. So, usually with fecal oral route, usually through ingestion of contaminated food or with anal or oral sex. So, nakipag-sex ka sa isang patient or sa isang individual, na merong hepatitis A and then oral sex or anal sex, yan siya. Next, for hepatitis B, this is caused by a virus that can cause both acute and chronic hepatitis. The transmission of this disease is through blood transfusion, tattoo application, sexual intercourse, contact with blood or bodily fluids, or via mother to her child by breastfeeding. However, the source of infection cannot be determined in about half of the cases. But mostly, ang nagkakos ng hepatitis B is more on blood contact. Okay. Kaya diba, careful tayo ng mga nurses na ma-avoid yung needle prick. Kasi what if hindi mo alam na may hepatitis B yung patient mo at needle prick ka, yung needle na ginamit mo sa patient mo, na i-prick mo sa sarili mo. So, pwede makakuha ka ng hepatitis B. Next, we have hepatitis C, which is caused by hepatitis C virus, a virus with an RNA genome, and that is a member of Viridae family. It can be transmitted through blood contact or sexual contact, which is also the same with hepatitis B. This can also cross the placenta. And Hep C or hepatitis C may lead to a chronic form of hepatitis, leading to a scarring of the liver called cirrhosis. So, pwede siyang mag-remain na asymptomatic, meaning pag sabihin natin asymptomatic, walang symptoms for 10 to 20 years. For hepatitis D, it is caused by hepatitis delta agent, which is similar to viroid. The disease can only propagate in the presence of the hepatitis B virus. Thus, a person can only get hepatitis D if he or she is infected with B. Okay, so, kumbaga, pag meron kang hepatitis B at lumalayan siya, pwede kang magkaroon ng hepatitis D. Then, hepatitis D is spread through blood contact and unprotected sex with a person infected with HDV. And this causes swelling of the liver. For the treatment for hepatitis, rest and optimum nutritional therapy, which includes sa diet therapy, sa protein, the diet should be enriched with foods that are concentrated sources of protein. Kasi nga for wound healing. Kasi nagkakaroon ng scarring yung liver, so kailangan mag-heal yan siya. Additional milk is usually included. 2 eggs for breakfast instead of 1 is acceptable. For energy, whenever the protein allowance is increased, the caloric level of the diet must be sufficient to meet the body's energy needs. For minerals and vitamins, the foods added to the diet for protein also increase the intake of calcium, iron, B-complex vitamins. Therefore, supplements are required only for patients who have faulty absorption. Moderate fat, at least 80 to 100 grams of fat should be provided daily. Hepatitis E produces symptoms similar to hepatitis A, although the process can be fulminant in some patients, particularly among pregnant women. It causes swelling of the liver without long-term diet. damage. A person can get hepatitis E by drinking water infected with the virus, and and can also spread through oral anal contact. So, ano yung mga sample protein-rich bedtime snacks? So, a sandwich, at least 2 slices of bread, 2 tablespoon of butter, 1 and 1/4 ounce of roast beef, 1 ounce of cheese, for milk, 1 cup, at least meron siyang protein na 29 grams and calories na 585. Pwede tayong magbigay din ng high-protein milkshake. So, another disease in the liver is the cirrhosis. Diba sinabi natin kanina, yung Hep C, nagkakause siya ng long-term na inflammation ng liver, and then pwedeng dumating sa point na magkaroon siya ng cirrhosis, or a chronic degenerative disease in which the buildup of fibrous connective tissue replaces the liver cells following fatty degeneration of long standing. It can cause liver cells to die and form new cells in scarring, which can lead to congestion of hepatic circulation, and this condition can contribute to further decline in the liver function. Treatment includes rest, supportive care, and nutritional therapy. So in severe cirrhosis of the liver, a serious complication of ascites or yung paglaki ng tiyan or pag-accumulate ng fluids sa abdominal cavity. So, diet restricts to 250 milligrams sodium may be prescribed in an effort to control the edema. Patients with cirrhosis of the liver are often depleted of protein. So, a protein intake of 100 grams at a sodium level of 250 milligram is possible. Okay? So, it is no longer believed necessary to restrict the amounts of fats in patients with cirrhosis of the liver. And alcohol is strictly forbidden to avoid continued irritation and malnutrition. So, edema is an imbalance in the capillary fluid shift mechanism caused by increased venous pressure from failing heart, compounded by aldosterone mechanism, which causes more sodium retention, and by ADH mechanism, which causes more water retention. Next, we have also hepatic coma, which happens when there is too much ammonia. Ammonia is a byproduct. Okay, byproduct yan siya ng pag-digest ng pagkain, okay, byproduct ng liver indigestion na food, so nagkakaroon ng ammonia, and dapat nare-release to siya through urine. At pag hindi siya nare-release at magkaroon ng accumulation sa ating blood, hindi siya maganda. So the brain is especially affected, and the patient becomes tremulous, disoriented, confused, and lapses into coma. The condition occurs in patients with severe cirrhosis of the liver. So the protein metabolism must be drastically reduced in order to correct the high ammonia. Okay, and the protein-free, the very low protein, and moderately low protein diets may be used in sequence. Okay, so diet therapy includes high calories, about 1,500 to 2,000 calories, to prevent tissue catabolism and the liberation of additional nitrogen. For the gallbladder disorders naman, we have first the cholecystitis. Yung cholecystitis is the inflammation of the gallbladder. Gallbladder, ang function niya sa ating katawan is the storage of bile. Bile is very important in order to emulsify or i-digest yung fat sa ating katawan. Okay? So, pag inflamed yan siya, so meaning hindi nakaka-restore enough yung ating gallbladder ng fat, and then hindi na natutunaw yung fat intake natin. So, which might result from either formation of gallstones blocking the cystic duct or infection of the gallbladder. This is very common among people consuming high fats and calories. The patient feels nauseated, vomits, and experiences chills and fever, indigestion, and heartburn. Meron din tayong tinatawag na cholelithiasis. Cholelithiasis develops when stones fall into common bile duct. So, pag meron ng stones, yan yung tinatawag natin cholelithiasis. So, there are two types of stones. We have cholesterol stones and pigment stones or gallstones. So, cholesterol stones form when the cholesterol in the bile gets too concentrated due to too much cholesterol synthesis or decreased bile synthesis. Meron din tayong pigment gallstones, which form as a composite of bacterial microcolonies and pigment solids. So the treatment includes nutritional therapy and also the reduced discomfort. Diet therapy includes low fat diet, okay, to avoid stimulus to the gallbladder. And then plain and simple fruits are recommended. Spices and high residue foods must be avoided as they may cause distension and increase peristalsis. So for foods restricted include the whole milk, ice cream, cream, whole milk, cheese, fatty meats, fish, poultry, chocolates, fried foods, gravies, cooking fats, lard, baked foods, okay, mga cakes, cookies, donuts, pastries, and pies, and sweet rolls. Limited din yung mga foods. Kumaga, pwedeng mag-intake yung patient, pero limited lang siya is yung mga lean meats, egg yolk, butter, margarine, and salad dressing. So food preparation, meat should be lean rather than marbled with fats. So vegetables cannot be dressed with butter, margarine, or sauces. Lemon juice, vinegar, and herbs lend variety to cooked vegetables. So vegetables and fruit salads may be included, but only lemon juice, vinegar, or low-calorie, fat-free dressing should be used. So hindi din, pwede din gamitin yung honey, jellies, preserves instead of butter may be used on bread. So, for pancreas naman, meron tayong pancreatitis, which is the inflammation of the pancreas due to decreased production of digestive enzymes. This condition may also result from biliary tract surgery, disease and surgery, alcohol abuse, and gallbladder disease. So, there are two types of pancreatitis. We have acute and chronic. Pag sabihin nating acute, this is the autodigestion originates from obstruction of the pancreatic duct. It is commonly caused by excessive alcohol intake, gallbladder disease. Patient often experience pain, nausea, vomiting, and diarrhea. We have also chronic, which the condition results in the permanent damage to the pancreas and characterized by chronic pain and abdominal distension. So, diet therapy, acute attacks. Pag may acute attacks, NPO or nothing per orem or nothing by mouth for 48 hours to avoid organ stimulation. Low fat, low elemental formulas when enteral feeding is appropriate. In chronic cases, a low to moderate fat, high carbohydrates, and moderate protein diet. Fluids and electrolytes are given intravenously and 6 feedings daily to facilitate adequate nutritional intake. And we have also cystic fibrosis, which is a hereditary disease in which the levels of sodium and chloride in tears and saliva, electrolytes in sweat, and viscous secretions in small intestine, pancreas, bile ducts, and bronchi becomes high. The lungs and digestive system are affected, mainly causing progressive disability. Life expectancy in between 30 to 40 years, and this is caused of improved treatment and prognosis. So treatment, improvement of nutritional status. Diet therapy for patients with cystic fibrosis includes calories enough to supply demands for growth, high protein diet to compensate fecal losses. We have liberal fat intake since fat is an important source of calories, vitamins and minerals, and liberal food intake. Okay? So, yan yung ating diet or nutrition therapy for patient with disorders sa liver, gallbladder, and pancreas. And last na i-discuss natin is the nutrition therapy for cardiovascular diseases, yung may mga sakit sa puso or sakit sa ating blood vessels. First disorder is the atherosclerosis, which is the hardening of the arteries. Okay, yung arteries natin, yung nagsusupply ng oxygenated blood natin is nag-harden because of sobrang ano to? Sobrang taas ng cholesterol content. So this refers to the thickening of the inside walls of the blood vessels. It is caused by accumulation of fatty materials including a high proportion of cholesterol as well as other substances. So the channel through the blood which flows becomes narrower. So pag ganun na naging narrow yung daanan ng blood natin, so nagkakaroon ng poor blood circulation at pwede ding magkaroon ng small blood clots which can cause sufficient clogging that no blood can flow through the vessel. So atherosclerosis is the most common cause of heart attacks. Kaya nagkakaroon ng heart attacks, biglang magsa-stop yung pagbibit ng heart mo. It's because meron palang nakaglag doon na mga blood clots. So those who are most susceptible to this condition and to other diseases are the following: male between ages 45 to 64 years of age, overweight persons, diabetics, persons with high blood pressure, persons consuming a diet high in saturated fat, persons with high cholesterol levels, persons whose family has a history of heart and blood vessel diseases, sedentary individuals, persons who have much tension, frustrations, and stress, and heavy smokers. So, treatment includes drugs and diet. So, yung diet na pwede nating ibigay sa kanila, a low-fat diet, low and saturated fat and cholesterol, increase in monounsaturated fatty acids to lower plasma total cholesterol and LDL cholesterol levels. And then, increase in polyunsaturated fats, the omega-6 or the omega-3, okay, such as, nakukuha sa fish like salmon, tuna, mackerel, sardines, trout, and herring, and then at least 2 servings per week to decrease plasma cholesterol levels. A total of 300 milligram cholesterol intake per day, so more egg whites than egg yolks. Organ meats taken once a month only, shrimps consumed occasionally, and meat and poultry limited to 5 to 6 ounces a day. An increase in complex carbohydrate intake and restriction of simple sugar, dietary fiber at least 25 to 30 grams per day, and restriction of calories at least 1,200 to 1,600 for women, and pag sa lalaki naman 2,000 to 2,500 grams for men. So next disorder is the congestive heart failure or CHF. It is a cardiac failure or yung a circulatory congestion resulting in the heart's inability to maintain adequate blood supply to meet the oxygen demands. Heart failure is characterized by shortness of breath or dyspnea and abnormal fluid retention, which usually results in the swelling of the edema of the feet and legs. So diet therapy for patients with congestive heart failure includes sodium restricted diet. Sodium attracts water. Okay? So, kailangan, ang water kasi, pag sobra-sobra siya sa ating katawan, it increases further our blood pressure. So, hindi pwede na nakaka-retain tayo ng so much sodium kasi it affects the water retention. So, this is used primarily for the prevention and control and elimination of edema. For mild restriction, at least 2 to 3 grams of sodium, no added table salt, okay, no salted foods, and all other foods are desired. Okay, for moderate restriction, at least 1,000 milligram sodium. So same as above, plus elimination of salt in cooking and canned vegetables. Basic foods are desired and processed with salt. Next, for strict restriction, so 500 milligram of sodium, same as that of moderate restriction plus increased control of food with higher amounts of natural sodium, such as smaller amounts of eggs, meat, milk limited to 2 cups, and vegetables such as leafy greens, beets, carrots, and celery. For severe restriction, at least 250 milligrams of sodium only, all the previous restrictions plus tighter control of natural food sources. Meat limited to 2 to 3 ounces daily and 2 to 3 eggs per week. Calorie control is applied to reduce the work of the heart. Texture control is applied in acute stages to aid in digestion, and caffeine should be limited. For hypertension or mga high blood na mga tao, it is also known as high blood pressure. It is common among males rather than females, 55 years and below. So treatment includes lifestyle modification and nutritional therapy. So for diet therapy, a mild restriction of sodium, occasionally a 1,000 milligram sodium diet may be observed or may be ordered. Weight reduction may facilitate the lowering of blood pressure. So kailangan magkaroon ng weight loss yung mga patient with hypertension, and low-fat diet with emphasis on unsaturated oils is recommended. So the sources of sodium Salt is 40% sodium. It is the principal source of sodium in the diet. 6 grams of salt would provide 2,400 milligrams sodium, and salt is used in food processing such as bacon, ham, dried fish, and etc. Baking and cooking, the table. And then we have also sources ng milk, okay? Pwede din sa meat, fish, poultry, shellfish, eggs, beets, and spinach. And last na disorder ng cardiovascular diseases, we have the myocardial infarction or MI. So MI or heart attack results from the atherosclerosis of the coronary artery. So, 'di ba nagkaroon ng hardening, nagkaroon ng narrowing, nagkaroon ng clogging, nagkaroon ng heart attack, that is myocardial infarction. So the treatment is for the reduced workload of the heart. Diet therapy includes liquid diet on initial stages, and as the condition improves, progresses to foods of regular consistency, small frequent meals, restriction on caffeine containing beverages to avoid myocardial stimulation. We have sodium cholesterol and fat calorie restriction and consumption of omega-3 fatty acid rich foods to reduce blood clots. Okay? So, dun ko lang isa-stop yung discussion ko kasi hanggang doon lang yung um, ano to, coverage ng ating finance kasi masyadong mapapahaba if isasama ko pa yung nutrition therapy for diseases of the kidneys and periodontal diseases kasi masyadong mahaba. But I will give you a copy of this PDF para at least hindi kayong mahirapan na mag-take notes ng mga na-discuss ko kanina. So, please do study for the upcoming final exam. It will be an online exam, and the same types, objective types with the board type questions para at least ma-enhance naman yung ability nyo for critical thinking. So I think that would be all. Thank you for watching and have a nice day.